In early May 2020, as COVID-19 ravaged Mumbai, the city's administration faced a very serious and unexpected challenge. From the most vulnerable and hardest hit patients, those on permanent dialysis treatment.
Kidney failure patients need dialysis 3 times a week. Even if they miss one dialysis, it can be life-threatening. In late April and early May, many dialysis patients missed their dialysis sessions and hence they died. Some dialysis centers just stopped functioning. There were various reasons for this. A large number of patients in dialysis centers started becoming COVID positive. As a result, there was a fear that other patients also might get positive. Those dialysis patients who turned COVID positive did not know which dialysis center to go to for their dialysis. Also, even if they went to the dialysis center, they were not getting slots for dialysis. Municipal Commissioner Mr. Chahal supported us in a very big way because without the machinery of municipal corporation, this was not possible at all. And it was his idea to take this through a software.
So if they had symptoms of fever or cough, or in some cases even if they were asymptomatic and they were tested, they had to be dialyzed at a suspect facility till the COVID report came through. All these centers, including the COVID suspect facilities as well as the COVID positive facilities, were started in public and private hospitals across the city.
Clearly, the COVID pandemic was beginning to affect our dialysis patients. Each day we had new dialysis patients getting diagnosed with the infection, and we did not have a readily available dialysis slot for them in a suitable facility in the city. The municipal corporation made a huge effort and classified centers as COVID positive, COVID suspect and COVID negative. So we had patients on one side, we had the solution in the form of the facilities on the other side. What was missing was the connectivity. To achieve this connectivity, we approached IIT Bombay, and they helped us develop a dashboard which eventually began to be called as Project Victory. So this dashboard helped identify each and every COVID positive dialysis patient in the city across centers, and readily available information on positive slots in the public and the private sector across the city were both available on the dashboard. The coordinator had to just link this patient to this facility, and within a record period of less than 48 hours, virtually 97% of such patients were able to receive their slot. So there were no deaths that happened either because these patients' dialysis was denied or dialysis was delayed.
The moment we realized that how alarming the situation was, Honorable Shri Uddhav Balasaheb Thackeray, Chief Minister of Maharashtra, Honorable Shri Aditya Uddhav Thackeray, Guardian Minister of Mumbai Suburban District, and our health department, we all swung into action and resolved to fully back this plan on dialysis.
Our success rate is comparable to one of the best in the world.
Chahal is a great leader, makes decisions very fast and execute them. He's a taskmaster. And the Honorable CM, Mr. Uddhav Thackeray, was very supportive and he was involved throughout the process.
We have been fighting COVID-19 since last year. The whole world knows how difficult this battle is. Sometimes many health crises occur simultaneously. While the pandemic was on, the other crisis was the need of many patients for dialysis. The big question was how to do dialysis in the COVID era. Often patients didn't even know whether they were COVID negative or COVID positive, but they had to have dialysis thrice a week to survive. In such a situation, Dr. Bichu came forward like an angel. Dr. Bichu, I would like to thank you and your colleagues very much. because your team, along with MCGM and the IIT engineers, came up with the concept of the portal coviddialysis.in. All our worries were removed. I would like to express my satisfaction that not a single patient has died due to lack of dialysis after this portal came in, and I thank you heartily for this achievement. In fact, Dr. Saib, the word thank you is very small for you. With all the machinery of the municipal corporation, the battle you and your colleagues are fighting day and night, I have no words other than to say a heartfelt salute.
Till December 31st, 2020, 1,418 patients had benefited. At a time of fear and despair, some of Mumbai's most eminent citizens came together to bring back hope and life. Let us celebrate the victory of collective vision and will. Project Victory.